Welcome in, everyone. Another edition of Sports Medicine Weekly on this Saturday morning. I'm Steve Kashul, Chicago Bulls radio host. So happy to be joined by my usual co-host. He's here in the chair once again, Dr. Brian Cole, the head team physician for the Chicago Bulls, one of the team physicians for the Chicago White Sox, sports medicine specialist, orthopedic surgeon with Midwest Orthopedics at Rush. Dr. Cole, how are you?
Doing great, Steve. It's wonderful to be back.
Yeah, let's talk
you.
about your vacation over the holidays. You went warm, then you went cold, but you went skiing in Park City, one of our favorite places on earth.
I know it's near and dear to your heart with a family who's been there for years.
Absolutely.
Yeah, so it was a great trip. It was the first December-January transition that we've had snow in many years. It's just been some awful winters out there. But it was wonderful. Had 3 or 4 great days of snow and wasn't too cold and it wasn't too crowded. You can't ask for much more, and it's a beautiful place.
It is. We've talked about this in years past. I have not skied in about 20 years. I think it is 20 years. And the last time I skied, no one was wearing a helmet.
Yeah, I'll tell you, it's now that would be the exception. I mean, it actually looks funny when you see someone skiing without a helmet. It's hard to believe. I would tell you sometimes the instructors from Europe and so forth, they're occasionally are not wearing helmets. But once you get used to it, your head's warm, and it's the real deal. I had an episode about 3 years ago when I was skiing with Steve and Phil Mayer. They used to be in the Olympics years ago. They're twin brothers who are phenomenal skiers. Anyway, skied well beyond my ability with one of them and lost it and came back. Hit the back of my head, split my helmet down the back. Okay, So can you imagine if I wasn't wearing a helmet, what would have happened? So I'm telling you, it's the real deal. That's one thing I would say is critically important. If you're going to ski, you got to wear a helmet, and you get used to it. It's great. It keeps you warm.
Do most people buy their helmets, or do you rent them? They also rent them, right?
You can rent them with skis and things like that. But yes, most people will buy them. All
righty, let's bring on our first guest to continue the conversation. Dr. Jeremy Alland, a sports medicine specialist with Midwest Orthopedics at Rush, primary care physician. Dr. Alland, how are you?
I'm great, Steve. Thanks for having me.
Jeremy, one of the things that's really interesting is, as I alluded to, when I skied recently, there were people occasionally not wearing helmets, which is the exception rather than the rule. And I know there's some controversy as to whether or not a helmet truly reduces the chance of a concussion. But I have to imagine that the data is there that it reduces the chance of something. If it's not a concussion, maybe it's severe head injury. What's your sense of the data out there, and is there any room there to say, look, it's not a good thing to wear a helmet? It just would be hard to imagine.
Yeah, definitely from our standpoint, we're really happy that more people are wearing helmets. It certainly prevents a lot of injury. Unfortunately, the data just isn't there in regards to preventing the concussions. We're seeing a lot more of these athletes coming in just because of obviously the media attention paid to concussion. We're getting a lot more after vacations and such. But when it comes to the helmets, it'll prevent the big one, just like you talked about with your story, Brian. But the concussions right now, the helmets just aren't helping a whole lot.
But that being said, if you could prevent a major injury, you would say, all things being equal, wear a helmet. Is that fair to say?
Absolutely. Absolutely. We know for a fact that these helmets are preventing major injuries. And even, let's say, hypothetically, that it doesn't prevent, an injury altogether. It's certainly taking what could be a catastrophic injury and making it more of a manageable, maybe short-term injury.
Yeah, I can tell you, when I fell, hit the back of my head and split my helmet, I know that would have been a whole lot worse. I had a headache. Maybe I had a low, so-called low-grade concussion, but clearly changed the outcome of that one.
Yeah, and I think the important thing to understand, and we certainly talk about this all the time, especially with football and such, is that the way that the concussion happens because the brain is sitting in fluid, and it's a lot of times the momentum that the brain takes within the skull that causes that type of an injury. And so the helmet, it's hard to prevent that with a helmet, but certainly things like lacerations, which bleed like crazy from the head, and major fractures and other things that certainly can cause long-term problems are being decreased with helmet use.
You're listening to Sports Medicine Weekly on this Saturday morning. Steve Kashul, Dr. Brian Cole. Our guest is Dr. Jeremy Alland from Midwest Orthopedics at Rush, talking about holiday ski trips, what parents and adults should know about concussions. And that's kind of the million-dollar word. I'm still trying to figure it out, even with my own sons. What exactly, Doc, in your opinion, is a concussion? How do you know if one has been sustained?
Yeah, in the metaphor I use with my patients is that a concussion is sort of like a bruise to your brain. It's obviously not like the whole chemical thing that we see going on, but when you think about it that way, it's the brain really taking on injury, getting a bruise, and the symptoms of it a lot of times are headache and fatigue, trouble concentrating, and we really just try to get across that if you're having any of those symptoms after you take some sort of fall or some sort of injury, to really take it easy and make sure that it doesn't get worse.
Jeremy, if you can give me sort of a concise answer, if you think you have a concussion, does it require a trip to the emergency room? Can you manage this on your own? And help us differentiate, when do you go to the ER and when can you just sort of sit it out until the symptoms completely go away?
The vast majority of these do not need to go to the emergency room. The warning signs we talk about, certainly if somebody's losing consciousness, going in and out of consciousness, vomiting, unable to take anything by mouth. But most of these, you're resting, and we try to get you into the office sometime in the next 24 to 72 hours after the injury to take a look at you.
Okay, bottom line, though, is completely symptom-free for at least 24 hours before you return to high-level activities. Is that fair to say?
I think that's huge, especially with these recreational athletes who are doing things like the ski trips. Is if you believe that you've suffered one of these injuries, really take it easy the rest of the day, because the major catastrophic problems with a concussion is getting another one really close to the first one.
Dr. Jeremy Alland, Midwest Orthopedics at Rush. Dr. Alland, thanks so much for joining us here.
Thanks, guys. Really appreciate it.